After California reported its first COVID-19 related death, the U.S. state is entering a new phase of the outbreak.
We have accordingly entered into this next phase that has required me, under the circumstances, to advance a proclamation of a state of emergency in the state of California. This is not something that I say hyperbolically and shouldn't be reported as such.
Over 15 states across the country have reported cases of the novel coronavirus, spanning from the epicenter of the U.S. outbreak in Washington state all the way to New York. Health officials are increasingly concerned, however, that problems with the country's healthcare system could make the outbreak worse. In an effort to slow the spread of the illness, Vice President Mike Pence announced the federal government will send 1.5 million test kits to hospitals across the U.S., adding the cost will be absorbed by government-run programs.
HHS has designated the coronavirus test as an essential health benefit. That means, by definition, it's covered in the private health insurance of every American, as well as covered by Medicare and Medicaid.
But more than 27 million Americans do not have any health insurance at all. For them, the cost of testing or submitting to quarantine could be prohibitive. Recently, a Florida patient feeling ill after a trip to China received a bill for over $3,000. In an attempt to quell such concerns, U.S. lawmakers have reached a bipartisan deal to allocate $8.3 billion in emergency funds to the COVID-19 outbreak response. The Trump administration is also considering using a national disaster recovery program to reimburse hospitals and doctors which treat uninsured coronavirus patients.
We've all done a very good job, all of us.